Assalamu alaikum dear students. In this video I will tell you about the topic amenorrhea. Amenorrhea in simple word is the definition is failure of menstruation in a girl or a woman that is sexually or reproductively active. So this is the definition of amenorrhea in simple words, but when we say in documentation, we call the amenorrhea is the absence of menstruation is known as the amenorrhea. Due to the menstrual age, we divide the amenorrhea into two categories. Number one is the primary amenorrhea and number second is the secondary amenorrhea. In primary amenorrhea, we call the primary amenorrhea when there is failure of start of menstruation with the age of 13 years with the presence of secondary sexual characters. But if the secondary sexual characters are not established or developed, and then we take the age for primary amenorrhea 16 years. So the simple definition is that the primary amenorrhea is that failure of start of the menstruation by the age of 13 years with the development of secondary sexual characters. But we call failure of start of the menstruation by the age of 16 years without development of secondary sexual characters. So this is the definition of primary amenorrhea. But in case of secondary amenorrhea, we call the secondary amenorrhea when there is the absence of menstruation for more than 6 months in the absence of pregnancy, and the woman is reproductively active. So in this case, previously the woman have menstruation, but due to other reasons or any other causes, there is absence of menstruation. In this case, we call that secondary amenorrhea. Now let's talk about the causes of amenorrhea. Before going to the causes of amenorrhea, we should have to know how the menstruation occurs in a woman. For this, we have to draw a flow chart. That hypothalamus is the mainly involvement, and then it also pituitary gland, and then ovary, and last one is the outflow tracts, genital tracts, and then menstruation occurs. Number one, hypothalamus releases gonadotropin releasing hormone that activate the pituitary gland, and then pituitary gland releases follicle stimulating hormone and luteinizing hormone. These hormones activate the ovary, and from ovary there is the release of estrogen and progesterone. These hormones ultimately make the changes that are present in the period of the menstruation to the outflow tracts, including uterus, vagina, and the breast ultimately, and the other things. Mainly the uterus is involved is endometrium, and then with the cyclic changes, the endometrium rupture and the wall of the endometrium rupture, and the bleeding occurs that we call menstruation. So this is the flow chart that describe how the menstruation occurs in a woman normally. But when we see that there is amenorrhea, the absence of the menstruation, So we have to know that, is there any problem in the hypothalamus, is there any problem with the pituitary, with the ovary, and with the outflow genital tracts. All these the problems, whenever there is a problem in hypothalamus, pituitary, ovary, they all affect the bleeding or the menstruation in a girl. So we find out the causes of the hypothalamus according to these causes of the amenorrhea according to these regions. Number one, if there is the hypothalamic disorder that lead to the absence of the menstruation in a woman, we come to know we should know about the factors that affect the hypothalamus. Number one, is she work in a condition where she have to heavy exercise. For example, her lifestyle is in such a way that she have to do heavy work daily, or that affect the hypothalamus. Number second is there any weight loss, maybe there is the presence of the hypothalamus tumor that result in the weight loss, and this affect the menstrual cycle. Is there stress, environmental factors including the family pressure or the economical issue that ultimately affect the girl with the amenorrhea. And chronic, is there any chronic disease of the lung, or there is drug history, is she is taking any drug that affect the hypothalamus, including dopamine, commonly used dopamine antagonist, the girl using, if she is using dopamine antagonist, it affect the hypothalamus, and hypothalamus ultimately affect the amenorrhea or menstruation of the female. Now we come to the pituitary. Is there any pituitary disorder that lead to the absence of the menstruation? For this we have to know about the is there any adenoma in the pituitary. For this, how we know that is there any adenoma that affect the menstruation? For this we have to know, we should ask about the milk discharge from the breast. Is there severe headache and the visual disturbances? Is these are present in the absence of the pregnancy? This is called Sheehan syndrome. In this case, TSH is lower with the FSH, that is also decreases. And another cause of the pituitary disorder is that is there slow growth and the weight gain. These are also contributed in the condition that there is the pituitary abnormality that lead to the absence of menstruation. So if there is pituitary abnormality, there is the effect of the follicle stimulating hormone and luteinizing hormone that affect the ovary. Now moving toward the next, ovary. As ovary, with the activation of the follicle stimulating hormone and luteinizing hormone, ovary releases estrogen and progesterone. So if there is a problem in the ovary, there may be the premature ovarian insufficiency. Premature ovarian insufficiency. If there is a premature ovarian insufficiency, the FSH that is released from the pituitary is normal, but the ovary affect the estrogen. So FSH is increased, that cannot stimulate the estrogen due to the problem in the ovary. So estrogen is decreased. In this case, we call this hypergonadotropic hypergonadotropic hypogonadism, because estrogen, due to the decrease in the estrogen, there is decrease in the modifications in the outflow genital tracts. So we call this hypergonadism, gonadotropic hypogonadism. Then another ovarian problem is polycystic ovarian disease. The short form is the POSD, polycystic ovarian disease, or polycystic ovarian syndrome is also called. In this case, if there is polycystic ovarian disease, there is oligomenorrhea. Oligomenorrhea is the condition when there is irregular periods of intervals of more than 35 days. More than 35 days irregular periods are under the heading of oligomenorrhea. Is there any hair growth? No. Moving to the next page.